Hi guys, welcome back to the Kevin TV. On this episode, I want us to talk about something really important. In this episode, we are going to learn about 10 nursing procedures you must know before your first clinical rotation. These are simple things and these are procedures that you must know before your first clinicals. I know this might be the first time you are going for clinicals and you've not encountered the real world at the hospital. Maybe you're in the hospital, so you might be wondering, what am I going to do? What am I going to say? And you see the hospital also a place that is different from the books that you are learning in school and different from your school's practical room. So you must know these 10 procedures before your first clinicals. The first procedure that we are going to talk about is hand hygiene. Hand hygiene is one of the most important things you must know before your first nursing clinicals. And very important. Before you enter the hospital, or the first time you enter into the hospital, wash your hands. Before you touch anything at the hospital, wash your hands. Before you touch any patient, wash your hands. After you are done going to touch, or after you are done touching the patient or doing whatever you are supposed to do for the patient, please wash your hands and make sure if you touch this patient, you will wash your hands before you go and touch the other patient. Hand washing is one of the most important things you must know before your first clinicals. Then the next one that you are going to also know, or you should know before your first clinicals, is how to check vital signs. Mostly students, when you vital signs is checking recorded. Please, you need to know how to check vital signs. You need to know all the normal ranges before your first clinicals. You need to know the normal range for BP. You need to know the normal range for oxygen saturation. You need to know the normal range for the respiration. And maybe you might find yourself at the ICU, or you might find yourself at the NICU. You see, that place, more respiration is different from maybe you being at the adult. So you need to know the normal ranges and everything before you go to your first clinicals. Important. This is the second procedure. The third procedure that you need to know before your first clinicals is administration of oral medication. You see, by the time you go to your first clinicals, you might have learned about medication. So you need to know how to give oral medication. At least, you need to know how to give the oral medication. After that one, you need to know the right of a patient. You need to know how to give medication. Before you give the medication, you need to know the right of the medication or right of giving medication. One, you need to know the right patient. You need to identify the right patient. You need to identify the right medication, the right route, the right time. The right time. You need to know all these things before you give the oral medication. This one too is one of the major things, or one of the procedures you need to know before your first clinicals. The next thing that you need to know before your first clinicals is how to monitor the blood glucose using the glucometer device. And I said using the device which is known as the glucometer, using the device which is known as the glucometer and the strips now and the checking. You need to know how to check it. Then you need to know the normal range for that one too. So we have the fasting blood sugar, then we have the other one too there. Yes, you need to get to know all these things. This one is one of the major procedures that you need to know before your first clinicals. Then the next one that you need to know is how to set up IV fluids. If you don't know anything, that one there you need to know. Because you could do that. Definitely one of your ICs or in charge will send you, Charlie, you need to know how to operate the flow rate. You need to know how to off it. You need to know how to on it. We need a basic nursing procedures that you need to know before your first clinicals. Or hanging you need to know. The simplest one is the one who you need to stop the nursing. You need to know it. So then the next one that you need to know is bed making. I know, most of the facilities that we have in our countries or have in our areas near you might go there, Ebiana, Sebi, bedsheet, cry anyhow. So, but that doesn't prevent you from knowing how to lay bed or how to make bed. You don't know how you're going to find yourself later down in life. So you need to make sure that before you go to bed, you need to know how to make simple unoccupied bed. You need to know how to make the cardiac bed. You need to know how to make admission bed and other beds. A procedure you must know before your first clinicals. And very, very important. Then you need to know how to position patients. You need to know all the positions that we have. You need to know how to position patients in a fouless position, the semi-fouless position, the prone position, the supine position. You need to know this before your first clinicals. This one too is also one of the procedures. Before answering the first clinicals. Then the last one that we are going to talk about is wound dressing. I know, say in your first clinicals, ABR now only wound dressing. I know, but please, ABR now you might be placed at the orthopedic and also be a surgical ward. That place, you can't tell me, say you are not, even if you are not going to do, or you are not going to, they are not going to allow you to do this planner, you are going to observe, and you observe, and maybe you might be assisting the patient or the person who is doing the, so you need to know the aseptic techniques are the wound dressing. Or maybe the facility that you are going to do the clinic as maybe a small facility, maybe the nurses there are 2. One student nurse, you are going to help them there. So you can't tell me, say when you go in there, you will learn about how wound dressing will be the nuclear banner. Maybe the other 2 nurses are busier. You will be the one to go do the thing. So please, these are the 10 procedures, or these are some of the procedures you need to know before your first clinicals. Then the last one I know, I told you I'm going to talk. The last one again, you need to know how to do patient assessment. This is your first clinicals. Please, don't rush. Keep quiet and ask questions. You keep quiet, you ask questions, then you observe things. So one, you need to know how to do assessment. Before you go for your first clinicals, you might have been taught how to do assessment, head to toe assessment for the patient. So you need to know that one. Then you need to know how to do proper documentation, because whatever that you are going to do for the patient will be, you need to know how to document it. And one question student nurse now say patient is dead. Later on, I say patient now, sorry, it's a patient now. Wanda nurse no call say patient in the